morning, and welcome to Delta Dental's 14th Future Focus.
I've been thinking about this morning for the past several days, and I guess that's what Future Focus is all about. To really inspire us to think about what we're doing, or more accurately, what we could be doing.
But I'm here today to talk to you a little bit about broadening horizons in oral health, talking more about social determinants, and hopefully to give you a little introduction into this concept of social determinants of health. Social determinants kind of takes a different perspective. Instead of just focusing on the individual, it looks at all the different forces that impact all of us.
I'm going to measure how long you're going to live, and in order for me to do that, I need to ask you 8 questions. Raise your hand if you believe you have the physical capacity and the desire to live to age 90. But most of what my team sifted out as the factors for longevity had nothing to do with diet and exercise. It was their attitudes. Family's always first. Here, the older you get, the more celebrated you are.
The secret to living a longer life is to set up your environment the right way. To surround yourself with people who encourage you to move, keep your brain engaged, who actually care about you.
You know, we go through our work days and I come to an event like this and I feel sincerely inspired.
But one of the things that I think employers don't think about as much is asking the employees, what is it that will motivate them? What are they interested in? What do they want to do?
I had always thought when I was brokering insurance and selling it, why do insurance companies always pay for the people that are sick? Why don't they spend more money on the people that are well to keep them well? Then it'll cost them a lot less.
And I think employers are holding workplace health promotion programs to a higher standard, and we're really asking the question, how do we define success? How do we know if a health promotion program is successful?
So the problem was they were forcing people effectively to get sick before they could get the oral health care they needed to stay healthy.
The whole concept behind the Blue Zones is really taking the lessons that have been around forever. And someone said to me a couple of weeks ago, you know, there's really nothing new there. And I said, well, yeah, that's the point.
So I think it was about making the environment fun, having your culture, have it be everywhere, in the cafeterias, in your vending machines, the wellness centers.
Longevity happened to these people. It was not something they pursued, not something they tried for. It ensued. It was a residue of their environment. A completely different way to think about health.
So health begins long before we visit a doctor. It begins where we live, where we work, where we learn, and where we play.
Raise your hand if you walked to school as a kid. I'd say almost every hand. Now raise your hand if your kids walk to school. I see 2 hands. Okay, so we have a childhood obesity problem. Why have we engineered that physical activity out of our kids' lives? The secret to longevity, whether it's individuals, communities, or workplace, does not rest with our doctors, does not rest with the federal government, and it does not rest with pharmaceutical companies. The secret to longevity is looking at the environment we live in, looking at the best practices we see around the world, and shifting some of that $2.1 trillion away from mitigating sickness and creating health in the first place by shaping environments that make the healthy choice not only the easy choice, but sometimes the unavoidable choice.